I'm very pleased to be here in the great city of Toowoomba today, joined by local member here for Toowoomba North, Terry Shine, and local candidate for Toowoomba South, Sam McFarlane. What we see here is a group of young men almost at the end of their apprenticeship, young men who will go into the building and construction industry. We know that that industry has a lot of opportunity in it, but we also know that many of the men who work in the construction industry work in jobs that can mean that they often don't get to look after themselves and their health enough. We know that some of the diseases and some of the illnesses that affect men in our community can be helped if men get help soon enough. We know that for many men, some of the issues with their own health get put to the bottom of the list of the things they feel they've got to do. That's why I'm very pleased to be joined here with my local candidates here in Toowoomba to talk about Labor's plan for men's health in a new elected Labor government. Our policy, our Everyman policy, will see $12 million invested in a number of new health initiatives aimed at improving the health of Queensland's men. These are our brothers, our husbands, our boyfriends, our friends. We want to make sure that men are looking after their health. Far too many men are seeing their lives cut short by preventable diseases or their quality of life diminished by diseases that could have been cured if they'd got to them earlier. This $12 million of new health initiatives for men in our community will focus on a number of issues. Firstly, the provision of 12 new prostate cancer nurses. These will be the first time we've seen prostate cancer nurses in the Queensland health system. These prostate cancer nurses are based on a very similar model from the McGrath Foundation breast care nurses. For many men, unfortunately, prostate cancer brings with it a number of emotional, social and psychological effects, and these dedicated prostate care nurses will be there to look after those issues for those men who suffer these issues and work with their families, just as we've seen those McGrath nurses work with families of women suffering breast cancer. It will also see an investment in 20 what we're going to call man's vans, 20 man vans that will travel around Queensland into all of the regions of our state and conduct what we call pit stop health checks. We've had our pit stop health check for men operating on a small basis over the last 2 years. What they do is go to places where a lot of men like to go, places like Bunnings, like hardware stores, and offer men a very quick health check by health professionals that can then see them identify those early factors such as high blood pressure and get them to a doctor when they might not have otherwise thought to do so. The 20 man vans will get to all of the regions of Queensland and conduct these pit stop health checks in and around all of our towns and cities. We would expect that the new man vans conducting pit stop health checks will provide this service to around 20,000 Queensland men every single year. If that means that some of those men pick up those symptoms early and get to doctors and get treatment and it saves their life or gives them a better quality of life, then that's a very good outcome for them and their families. The final part of the program will see a very big boost to the program we've been working on construction sites, identifying particularly the issues associated with weight in construction work. Buster Gut program has been put in place in partnership with the government and the building industry superannuation scheme. And it's about getting out onto building work sites and working with men on construction sites where they work, doing health checks and getting them to doctors when they need to get there. This is again a very small program that has worked and we're now going to see it expanded. What we expect is it will see around 10,000 construction workers every year having those health sessions at their workplace as part of a partnership between the government and their superannuation scheme. So this is a $12 million investment in good health preventative work for the men of our community. As I say, these are our brothers, our uncles, our husbands, our friends, and we want to make sure that men's health is getting the focus it needs. Often, these are issues that aren't easy for blokes to talk about. And if we can go to their workplaces, if we can take these health checks out to where men like to go, whether it's the hardware on Saturday mornings, whether it's the men's shed, or their workplace, then we'll be doing a great service to them and their families in the long term. So our government wants to see a healthy Queensland, and that means making sure we put new focus where it needs to be. We believe that we want to see the life chances of men in Queensland increased, and that means getting to some of these diseases earlier, and that's what this program is aimed squarely at doing. Okay.
Premier, given all the problems in Queensland health and hospitals at the moment, is this the best that you could come up with?
Putting money into preventative health care takes pressure off our hospitals and improves the lives of Queenslanders. Of course, we want to have great hospital care, and you're seeing that with a big investment, the biggest investment ever in new hospitals and their upgrades. But the very best thing is to keep people out of hospitals by keeping them healthy. Investing in checking men's health before the problems and the diseases get too advanced not only improves their life and their life expectancy, but takes pressure off our health and hospital systems.
Premier, the prostate cancer nurses, will they be based in Brisbane and travel around the state where they're needed, or how do you envisage them working?
The 12 prostate care nurses will be based in our major regional centres. So we'll have a number in Brisbane, as well as high population areas like Cairns, Townsville, Mackay, Rockhampton and Toowoomba here. So you will see these prostate care nurses part of delivering cancer care services in those major regional centres that deliver cancer services.
Is there anything in this package specifically targeting alcoholism? That's a big issue for men and their families.
All of these programs will be looking at diet, at lifestyle, at weight, as well as things like alcohol. We know that there are a number of diseases, including obesity, that are not helped by high alcohol consumption. So whether it's issues with alcohol, whether it's issues with depression or lifestyle matters that can all lead to serious diseases and serious health problems, they'll all be targeted in these programs.
We're at the halfway mark of the campaign. The election promises have been fairly minuscule so far. Is that because there's no money to spend in the state?
What you've seen from Labor is a very responsible attitude to the election commitments we are making. Every election commitment that I have made has been fully funded, and the source of the funds has been put into every release about every promise. That stands in stark contrast to the reckless attitude being taken by the LNP. The LNP have now clocked up some $7.5 billion worth of unfunded spending promises. That is simply reckless and fiscally irresponsible. When I make a promise, I know we can fund it, and I tell you where the money's coming from. Campbell Newman has yet to do that for a single promise.
Yesterday, though, you said that the promise you made yesterday for roads would come largely from revenue derived from fines. What was that money normally used for, the fine money, and how can you just reallocate it to something new?
No, I said yesterday that these funds have always been dedicated to road safety. Yesterday's announcement outlined our priorities for road safety and gave commitments to those communities who have been looking for improvements on those parts of their network that a new Labor government will deliver those particular